Psyche community. My name is Beth DiNapoli, a medical science liaison for Otsuka Pharmaceutical Development and Commercialization, Inc. And today I'm presenting on mindfulness meditation and mental health. This presentation is sponsored by Otsuka Pharmaceutical Development and Commercialization in Lumbeck, LLC. So over the past few decades, mindfulness meditation has been increasing in popularity with an abundance of publicly available resources on the topic. The goal of this presentation is to provide you with a brief overview of mindfulness meditation, specifically the methods and techniques used in mindfulness meditation. And then we will also review the evidence on the effectiveness of mindfulness-based interventions for mental health disorders, as well as discuss some of the potential mechanisms of action. And then lastly, we will end with a 10 to 15 minute exercise actually engaging in mindfulness meditation. So let's start with the question you all may be asking, which is what exactly is mindfulness meditation? As John Kabat-Zinn said in the quote on the top of the slide, mindfulness meditation is a family of meditation practices that shares an emphasis on reducing distraction and enhancing awareness of present moment experience. Most mindfulness meditation-based interventions rely upon the principles of mindfulness-based stress reduction, or MBSR, which was developed by Kabat-Zinn in 1979 as a means of addressing debilitating stress in ambulatory patients. Since then, numerous other versions and renditions have been made, and some of those other mindfulness-based meditation interventions include mindfulness-based cognitive therapy for depression and mindfulness-based relapse prevention for drug addiction. So while there are less structured, brief forms of mindfulness meditation, the majority of the data that I'll be presenting on today comes from more formalized structured interventions. So these interventions are rather intensive. The basic structure usually includes 8 weeks of a program or treatment with 2.5 to 3.5 hour sessions a week. And during these sessions, individuals are usually taught to learn mindfulness meditation techniques, and they also have didactic instructions on relevant topics. Individuals are usually also asked to engage in 45 minutes of homework a day, which will include practicing mindfulness meditation. So the instructions and techniques for mindfulness meditation follow a pretty typical protocol. In terms of posture, it is commonly conducted in a seated position, but could also be done lying on one's back while slowly walking or even in yoga positions. During the seated position, that generally begins with a focal object of meditation, and usually that's the sensation of breathing. Practitioners are instructed to adopt a non-adversive stance towards experience with an open or curious attention. Individuals should attend moment by moment to the object in a non-judgmental way, while also maintaining a relaxed awareness of distraction. When distraction does occur, practitioners are taught to recognize that distraction and without judgment or reactivity, return their attention back to the object. So unfortunately, there's really a lack of clear scientific consensus on the precise mechanisms of mindfulness meditation, and we'll go over some of the proposed mechanisms in the next few slides. But there are, however, some commonly acknowledged core capacities targeted by mindfulness meditation training. And those include meta-awareness, person-centered awareness, non-reactivity to experience, and de-reification. So first, meta-awareness. This refers to the capacity of individuals to monitor and report on current contents and processes of their mind. The person-centered awareness refers to sustaining the focus of attention in the present moment. So the capacity to sustain person-centered awareness, that's oftentimes facilitated by that moment-by-moment focus on the meditation object. So for example, attention should be focused on breathing, if that's the meditation object, instead of thinking about tonight's dinner or maybe last year's Christmas party. Non-reactivity to experience refers to stopping those usual effective reactions to the current content of experience. And that can be fostered by rehearsing that curious or non-judgmental stance towards experience. And part of this that is really important is also reducing the avoidance of internal stimuli, which will in turn facilitate a more accurate perception of mental content. And then lastly is de-reification, which is the reduction in the habitual attribution of objective reality to the contents of thought and perception. So it is frequently the case a distracting chain or thought might capture the attention or pull the attention away from the object. De-reification is trained by recognizing that the thoughts are just thoughts and not reality. So for example, knowing that one's thought about an upcoming presentation is not the real depiction of how that presentation is actually going to go in reality. So psychopathology is now widely understood to originate in dysregulations or dysfunctions of underlying cognitive and affective systems. So before we begin or review the effectiveness of mindfulness meditation for mental health disorders, let's talk about how mindfulness meditation influences some of these core neurobehavioral systems. So the core capacities that we just talked about, those are strongly linked with cognitive function. You can see in the first bullet point, the results using conventional executive functioning measures, those have been mixed, but we have seen that training effects have been more apparent on tasks and measures that are more directly linked to those core capacities that are trained in mindfulness meditation. So for instance, improvements have been found in meta-awareness, cognitive flexibility, memory specificity. There is also robust support for reductions in attentional capture. So developing the capacity to detect and disengage when attentional capture by future or past-oriented thinking is an important theoretical mechanism by which mindfulness meditation can improve psychiatric symptoms. So shifting to the right side on the affective systems, so through meta-awareness of mental processes and maintaining that present focused attention, mindfulness meditation may improve the ability to detect and recognize emotional states. However, this data has been somewhat mixed. Another potential mechanism is through altered emotional reactivity. So if you think about an individual that might have panic disorder or anxiety, their heightened awareness of stimuli or even internal bodily sensations can increase their emotional reactivity to those sensations, which in turn increases anxiety responses. However, it is thought or proposed that incorporation of de-reification and non-reactivity in mindfulness meditation training, those might actually reverse this response. Another potential mechanism is cognitive reappraisal or restructuring, which is often thought of as modifying an altered interpretation of a situation to promote a more healthy adaptive emotional response. However, behavioral evidence is lacking as well. So lastly, there is evidence regarding the effect of mindfulness meditation on reward processing that has emerged from studying reward-related disorders such as smoking. It should be noted that a lot of the research in this area is still in its preliminary stages, but nonetheless, even there's enough evidence that has accumulated that suggests that mindfulness meditation does have significant effects on multiple mechanisms of actions that are relevant to psychophysiology processing. So that brings up the question of whether these interventions work to treat psychiatric symptoms. To answer that question, a recent meta-analysis looked at randomized controlled trials examining the effects of mindfulness-based interventions on disorder-specific symptoms across psychiatric populations. So this study included 171 articles with over 12,000 participants. So for studies with no comparison, and that's the first row, mindfulness meditation-based intervention showed superior effects on disorder-specific outcomes for numerous mental health conditions or disorders, including anxiety, depression, pain, schizophrenia, weight, eating-related disorders, and substance use addiction. In the second row, you can see mindfulness mindfulness-based interventions were superior to active controls for depression and addiction, and they were equivalent to active controls for anxiety, pain, and weight eating related disorders. When compared with evidence-based treatments, mindfulness-based interventions were superior to evidence-based treatments for smoking and equivalent to evidence-based treatments for anxiety and depression. The magnitude of effects, which you can see from the Cohen's D's listed under the columns in the current study, suggest that mindfulness-based interventions are, on average, associated with moderate drops in psychiatric symptoms. So these results as a whole really support the notion that mindfulness-based interventions hold some promise as evidence-based treatments for a variety of mental health disorders. There's also neurobiological or neurobehavioral evidence regarding the potential mechanisms of action for specific mental health disorders. So for depression, mechanistic research supports the efficacy of mindfulness-based cognitive therapy in targeting depressogenic cognitive processes. So individuals with depression, they oftentimes struggle with rumination or have a negative thoughts, downward spiral of negative thoughts. Mindfulness meditation training is designed to help these individuals exit their depressive rumination by returning their attention to the present moment. Mindfulness-based cognitive therapy has also been found to reduce overly generalized autobiographical memory and increase the ability to suppress irrelevant mental sets. On a neurological level, this account is supported by mindfulness meditation-related decrease in the default mode activation and increases in default mode connectivity with the dorsolateral prefrontal cortex. As with depression, a primary candidate for the effects of mindfulness meditation on anxiety is a reduction in that repetitive negative thinking and associated activity in the dorsal medial prefrontal cortex. Another obvious candidate for anxiety is exposure leading to reduced reactivity in individuals exposed to both cognitive and physiological symptoms of anxiety during mindfulness meditation practices. Also, decreased self-reported anxiety following brief mindfulness meditation training has been associated with increased activation in regions of the brain that are important in effective appraisal and responding during meditation compared to when individuals are at rest. In terms of pain, if you take all the results taken together, the findings really indicate that mindfulness meditation related changes in sensory processing reactivity, the appraisal, and pain-related cognitions may contribute to the improvement of pain-related distress. And then lastly, the proposed mechanisms underlying the mindfulness meditation-based interventions for substance use include response inhibition and extinction, as well as changes in reward processing. So for instance, mindfulness-based meditation-related reductions in smoking have been associated with lower amygdala and insula activation in response to stress cues. In addition, the reduction in smoking behavior followed by brief mindfulness meditation training has been associated with increased resting activation with anterior cingulate cortex and medial prefrontal cortex. So more neurobiological evidence exists for the role of mindfulness meditation on reducing stress. On the left side, in study 1, researchers were looking at what actually is the abnormality in connectivity in stressed individuals. So the connectivity between the dorsal anterior cingulate cortex and the amygdala is excessively connected in those with perceived stress compared to unstressed adults. And this presence of too much connectivity in this pathway is not only associated with increased perceived stress, but is also associated with difficulties with anxiety and major depressive disorder. And on the right side, researchers offered individuals relatively brief mindfulness meditation or relaxation training. And those that received mindfulness not only in their clinical symptomatology, but there was also a significant decrease in the amygdala anterior cingulate cortex connectivity. On the other hand, this connectivity did not reduce in those that had received or engaged in relaxation. So therefore, mindfulness meditation training but not relaxation training, decreased amygdala ACC connectivity and improved perceived stress. Unfortunately, the effective implementation of mindfulness-based interventions requires addressing significant challenges and questions related to intervention format, the training and fidelity, as well as cross-cultural fit. So one potential implementation limitation is that teacher training is rather extensive and mindfulness meditation experience is essential. The required time and costs will likely be infeasible for a lot of clinicians. On the flip side, an advantage in the area of training has been the development and validation of measures of mindfulness meditation adherence and competency. Treatment dosage, the format of the training and the practice setting are also key practical considerations for implementing mindfulness meditation interventions. As I said earlier, the duration is typically 8 weeks in length, and many people find this structure acceptable. Yet, for others, the intensity of the intervention may not be feasible or desirable. Additionally, there hasn't been a systematic study yet that has been conducted to determine the optimal length or duration or the amount of practice that is needed. A potential advancement is that online delivery has shown small but significant effects on depression, anxiety, and well-being, so that use of mobile technologies may offer the possibility for increased accessibility. And then lastly, for access to translate treatments to be more culturally acceptable, there needs to be culturally modified treatments. And a recent meta-analysis found promising support for the utility of accessibility of mindfulness-based treatments for people from diverse, underserved backgrounds. So before we end, we're going to spend about 10 to 15 minutes actually engaging in an example mindfulness meditation exercise. So I will pause now and let my colleague, Dr. Roland Larkin, a MSL or Medical Science Liaison from Otsuka Pharmaceutical, lead you through a mindfulness meditation exercise.
Hi everyone, thanks for listening and I hope you're doing well. Today I'm going to help you achieve a deeper level of relaxation. Most people find this as a pleasant experience. It's not hypnosis, you will not lose consciousness, and you will not lose control. You will simply begin to feel more relaxed, more comfortable. We'll use a combination of several different proven breathing techniques and focusing methods. Before you enter this mindfulness practice, find a comfortable seated position, a place that you will continue to be comfortable as we practice relaxation. We'll need about 10 minutes to move through the experience. If you would like, take a minute to remove your eyeglasses or any distracting jewelry. Mute the ringer on your phone if it's on. If you're choosing to sit in a chair, uncross your legs and place both feet on the floor. Uncross your arms as well. Gently move your body as needed to increase your comfort level. Once you settle in, take a deep breath and then a long exhale while closing your eyes. Keep your eyes closed as we continue our mindfulness. Focus your attention on my instructions. If you prefer not to close your eyes completely, then just assume a soft gaze. Relaxing into this moment, feel gravity pull down on you as the weight of your body makes contact with the ground below. To begin, adopt an attitude of relaxation, a relaxed, participant, passive attitude. If there are some distracting noises that enter your frame of mind, that's okay, just let them pass. If your mind wanders away from relaxation to other matters, that's okay too. Allow your mind to wander, and in time it will wander back to relaxation. Maintain a relaxed attitude about your mind wandering. You cannot hurry or force relaxation. Just allow yourself to gradually slip into relaxation and allow it to happen at its own pace. Now, let's take some deep breaths. I want you to take a deep breath, hold it for 5 seconds, and say relax as you slowly exhale. Go ahead and do this now. If you notice that the timing is off or you're rushing, just hold the breath a little longer or take a longer, slower exhale. Now go ahead and take 4 more deep breaths. Hold each one for 5 seconds and say relax softly as you slowly exhale. 4 times, doing your best to take nice, deep breaths and saying relax quietly as you exhale. Going to help you focus attention on different parts of your body. When you focus on a part of your body, I want you to let go. Relax. Release whatever tension you find in that part of your body and seek out comfortable feelings of relaxation in its place. We're going to focus on different parts of the body, and we'll spend about 45 seconds on each. Let's begin with your right arm, your hand, forearm, and upper arm. Let the tension drain from your arm. In your mind, seek out sensations in your arm that are peaceful and comfortable, tranquil and soothing. Let the relaxation in your right arm grow deeper and deeper. Let's continue with your left arm, the left hand, forearm, and upper arm. Just let them go loose and limp, soft, calm. Let the comfortable feelings of tranquility grow deeper and deeper, deeper and deeper. Focus your attention on your face and your neck. Let all those muscles go. Forehead, jaw, tongue, and the many muscles in your neck. Let the tension in those muscles melt away and dwell upon the comfortable feelings of relaxation that are growing there. The peaceful, tranquil feelings of relaxation are growing deeper and deeper. Now I want you to focus on your chest, your back, and your abdomen. Let go of those muscles. Allow your breathing to slow down and relax. Feel the muscles becoming soft and loose, soft and loose. Focus on the calm, soothing sensations in your chest, in your back, and your abdomen. Now focus on your right leg. your right foot, calf, thigh. Let go. Let the tension drain away and focus on the pleasant, relaxing sensations, growing deeper and deeper. Let the warm, comfortable feelings of relaxation grow in your right leg, deeper and deeper. Let's continue with your left leg, your left foot, calf, thigh. Just let them go loose and limp, soft and calm. Let the comfortable feelings of tranquility grow deeper and deeper, deeper and deeper. Now I want to suggest some phrases that you can repeat slowly in your mind to help expand the sensations of relaxation. The phrases go, I'm at peace, my arms and legs are heavy and warm. I'm at peace, my arms and legs are heavy and warm. I'm at peace, my arms and legs are heavy and warm. Repeat this slowly in your mind and try to feel the peacefulness, the heaviness, and the warmth in your arms and legs. I'm at peace, my arms and legs are heavy and warm. Go ahead and repeat this slowly in your mind and feel those sensations. Okay, this relaxation session is concluded. You can open your eyes whenever you're ready and sit up.
Hopefully you found this exercise valuable and you got a brief glimpse into mindfulness meditation practices. Just as a reminder, the goal of mindfulness meditation is to focus on increasing attention and enhancing awareness of present moment experiences. As I reviewed today, there is mechanistic evidence for mindfulness meditation in improving functioning in positive and negative affective systems. And these interventions can perform comparable to established treatments for symptoms of depression, anxiety, pain, and substance use. And while advances have been made to improve access and implementation, continued work is needed to address additional challenges. For more information on this topic or to request a more detailed live presentation of this topic from your local medical science liaison, please visit www.psychu.org. That concludes our presentation on mindfulness meditation and mental health. Thank you for listening.